Okey-dokey. Looks like it's recording. Okay, everybody. Well, I've got visitors here. Headphones on. Welcome. Thanks for jumping online. I really appreciate it. So this is one of the little units that's in the business certificates, and it's engaging with customers. And this part of the training for you today is management of feedback and complaints. So it really applies to any industry, really. We get complaints in all sorts of jobs, don't we? So be in 2 sessions. This will basically just start off with complaints, and in the next session we'll talk more about managing and the legislation around it or behind it. So this particular course is aimed, you're all enrolled to do a business certificate so that you can work in reception in a healthcare service. So that might be a doctor's reception, the emergency reception, or the front office. So you're going to have people coming around you. So I will share my screen if I can find the right one. So what are you getting up on your screens, guys? Have you got?
Nothing. I've only got a blank screen so far, Wendy. It says Wendy has started screen sharing, but I'm not getting anything.
Right. How about? That's interesting. Try again. Here we go. Here we go. There we are. You got a PowerPoint there now, right?
Yep, got it this
Beautiful.
time. Yep.
Awesome. Okay. This is quite wordy, and I'm not going to read it word for word. Of course, you would all get a copy of these notes. And I just want to start by saying that all healthcare services attract complaints or negative feedback from time to time, and many of us dread with having to deal with these complaints. If they're handled sensitively and skillfully, they can be actually a positive experience, and they play a part in informing our risk management and our quality improvement. So I don't like them, but they have a really positive role to play. I'm just going to look at the time, 14. So at the end, you'll understand why complaints and feedback can be useful, how to help manage a complaint effectively, and we'll talk about a complaints management system. And in the second session, we'll talk about some communication strategies with difficult situations. All right, just to get us going. All right, this is going to get you all involved. This is one of David's little favourite games. So, Jackie, do you want to give me a number and I'll click it away?
All right, let's go 3.
Number 3. So we're going to see if we know where we are. This is a local spot some of you would have seen. Emily, if you got a number you can give me?
6.
6. Ooh, that's a good hint. How about you, Mark?
No, I know where it is.
I'll go 11.
Oh, okay. Jackie's hands up.
The lagoon, is it?
It's the suspension bridge at the Fourth Rock Lagoon.
Oh, too easy. With a beautiful reflection there. Let's hope this works. No. I knew it wouldn't happen. Oh, goodness. Now I can't even get rid of that. Go away. This is the moment she regrets going first. Oh. I'm just seeing if this is going to work. Oh my goodness, that's a big no. All right. Well, I'm in trouble because none of my videos are going to work. So despite all best efforts, near misses, mistakes and negative experiences happen when we're delivering healthcare, and the complaints and negative feedback are just a natural expression of that. So what we do know is that complaints can give patients and their families an opportunity to express their opinions and their emotions, and they can often help prevent a further deterioration of the situation when people actually do speak up and complain. We need a system that we can manage complaints effectively and encourage people to give us feedback with information on our mistakes and any adverse outcomes, and then we gather that information and we analyse it. And it's a blame-free culture. It's not pinning blame on anybody. It's about working out the best resolution, because lessons can then be used to improve our service. So prompt, effective management of complaints can significantly benefit the patients, the staff, and the overall healthcare service. So this is some of our questions that I've put along the way. So your assessment will be done together. So who would like to have a go at this one? So the main aim is to ensure that effective and efficient response to complaints happens with our management process. Jackie reckons true? Beautiful. Too easy. Good job. For staff, acknowledgement of errors can help develop a better relationship, improve patient-centred care, and develops evidence-based practice. And organisations benefit by improving the quality of care provided and reduce the likelihood of negative outcomes, and including litigation, which is a very negative outcome for hospitals. And it ultimately will reduce the cost of providing the service. So what is a complaint? This is the actual definition we're given. The statement, an expression of discontent or unhappiness about a particular situation. We kind of know in ourselves what a complaint might be. And any consumer of a health service, including the patients, the clients, their family, friends, and other service providers are allowed to make a complaint. Has anyone had to make a complaint to a healthcare service? No?
No, I've never made a complaint. I actually wrote them a thank you letter before in the past for care of my mum. But I didn't really have anything to complain about. I thought their service, this was at the Hamilton-based hospital. I thought they provided a really good, respectful, caring service for my mum in her last few days at the hospital. So
you gave some positive feedback. That's awesome. Yeah.
Yeah, I did. And I took them a whole heap of coffee sachets and chocolate.
Awesome. Thanks, Jackie. It's also important to know that staff within the organisation also raise concerns on behalf of a patient too. So what do you think most complaints are about in healthcare? What do you think people might complain about? You got any ideas? Mark, Em?
If they think they're not getting a good level of care.
Yeah, so the actual care they're receiving, their treatment is one area. Yep. Anything else, Mark? What do you think people might complain about?
I think they might complain about, or relatives might complain about what their perception of care is with regards to their loved ones in the hospital.
Yeah, that's good.
Whether right or wrong.
Yep. So when we break it down, when we look at healthcare complaints, this is across Australia. So facilities, so what's available, the actual cleanliness of a place or the steps, so the actual buildings. Resources, what's available, and that can sometimes happen in a town like Portland when we don't have all the actual resources that you might have in a larger facility. Standard of practice, and that's the one you've touched on there, the care that people are getting. Lack of support is a big one, and the bottom one, poor communication. And when we look at our complaints here, communication is one of the biggest areas we get complaints about. So it can be formal or informal complaints. So a formal process is where we get individuals to provide feedback on a specific forum. We might send out surveys, or there can be informal complaints, which are verbal in person or on the phone, or a written letter. I'm going to get you to answer this one. Em, what do you think? You can just tell me verbally and I'll click on. So complaints must be made in writing. which could be letters or faxes. Is that true or false, do you think?
Well, that's a pardon me, a hard one, because you don't have to complain yourself in the writing, but it needs to be written down.
No, it doesn't need to be written. It can be, it can actually be,
Really?
yeah, you can make a verbal complaint. You don't, and that it often puts people off thinking they have to put in writing. But if you tell someone and you would like it registered, the staff member can do that on your behalf, or you can come down to see the quality manager in the office and complain to them. So you don't actually have to put a writing in, you can actually make it verbal. We'll formalise it, but you don't, the patient or the family member can make a verbal. So even the most minor complaints can reveal a problem within a service, and what might seem minor to people that don't want to complain can have a big impact when we find out about it. So it might seem inconsequential, but they can have a big impact. I can give an example here at Portland. We got a little complaint. We didn't think much of it about parking, and we get a lot of complaints about parking, I can tell you. But there was a pattern of complaints about certain patients, and they were the dialysis patients, not being able to get close enough because they're very weak and they have to come in 3 times a week to have their dialysis. So when we've worked that out and it was brought to our attention, what we were able to do is get them a special area they could park so they had quick access to the lift and up. It was a very simple problem to solve for that particular group of patients, which we weren't even aware of until it was brought up. So there's 3 categories of complaints. The point of service, which is right where the patient is. So that's straightforward, easy to manage, and we can usually quickly work something out with the patient. And that might be as simple as the cup of tea was too cold, or they've got back from X-ray and their meal wasn't there, or someone's missed out on their pain medication and they let us know. So there's simple complaints that we can deal with at the time. The second one is where complaints need a bit more investigation. They're more serious and complicated, and they might need to be referred to someone senior or a manager. And then the third level is where they can't be resolved by the hospital and they are managed by an external organisation, so they're escalated to the Health Services Commission. So regardless of the severity, all complaints are given consideration and they're recorded, as they may indicate an individual or a systemic problem, like I said, with the parking. Good luck with this. Oh no. Ooh, hang on. Crikey. I don't think you want an ad for Hungry Jacks. Sorry, guys. So it's just a little explanation of that Healthcare Commission. So the Healthcare Commission will only want to know if complaints haven't been resolved by the service. If you go there to complain about your care, the first thing they'll ask you is have you tried to resolve it with the healthcare service. So why do patients complain? As I said, the majority are related to communication, and that can be a lot of different things. Lack of attention, miscommunication, not knowing what their plan of care is, rudeness by staff. And although the majority of complaints might be seen to be wanting compensation, or most actually just want an apology or an explanation of why something happened and reassurance that it won't happen again. So consumers, patients, residents respond to negative situation in a variety of ways. Some shy away from complaints, while others complain loudly and repeatedly. So feedback, which is what we call complaints and compliments, what Jackie's given is a compliment, it's still patient feedback, and complaints is feedback. And we call it feedback because we want consumers to give us those complaints. We want to know what we can improve. And that's what that on the left, it's about quality improvement and managing risk. And there are benefits in encouraging feedback. So from a quality point of view, when we get feedback, it includes the changes that will lead to better care, better systems, and professional development for our staff. And those changes can happen by anyone. That might be our healthcare professionals, so patients, families, researchers, funding bodies, the government, planning committees, and educators can all implement quality improvements. So an effective complaint management systems are a vital source of information for improvements. They allow for us to identify problems and resolve the overall risk management. So professionals, patients and families have a unique experience in their own healthcare they've received, and both compliments and complaints are valuable sources of data. So encouraging feedback can help an organisation understand current problems. It can monitor the impact of things that we're improving. So we might have a quality activity we're improving, like a new building, and complaints about that might help us change what we're doing. It helps us sort of monitor our performance and compare with other organisations, because we register our complaints and they are measured with benchmarking against other hospitals in the area. What are we doing well against? Are we getting complaints or feedback about our food, our cleanliness, or our service? They also improve communication. They help us build trust and confidence in the service. They help us provide the service. Just excuse me for a minute. Background noise. Sorry. They enable, what was I up to? The provision of services based on what the client needs. So we might get some feedback on what we are or aren't providing in an area. They give some accountability to our consumers, and they enable our clients to input so they can help shape the services they want. And they help identify some performance issues sometimes for our staff. Okay. So complaints should be considered what? What do you think? We've got a few options here, and one of them's correct. Someone give me an incorrect one. Anyone?
The incorrect one would be disruption to the service that should be avoided if possible.
Yeah, that's right. We'll knock that one out. Good job. Yeah. How should we be considering them? We're not putting in a complaint. It's not necessarily a sign that someone's doing their job properly. Not doing their job properly. So we'll knock that one out. So which do you think it might be?
A unique source of valuable information.
Bingo. Yeah, absolutely. That's what we're after. Good job. I'm going to risk it for the biscuit. Not necessarily complaints, but this is a friend of mine on good old TikTok, if we can get him up.
Open. Not getting anything, Wendy. I'm not sure about anybody of the other guys.
No, I mean,
Just some of the complaints we hear. I think from that perspective, complaints means what they've come into ER complaining with, but I just thought I'd lighten you there. All right, does anyone have any questions so far about complaints? No, excellent. My goodness.
I might have a question just for pure interest's sake.
Yes, go for it.
If you have someone comes in a face-to-face environment, so in person,
Yep.
and they're very abusive, like over the top abusive and
Yep.
threatening, what sort of step do you take from there? Does the hospital have a, would they request them to come into a private room so it's not disrupting the whole,
Yep.
workplace area there?
Absolutely. So that, yeah, because that's crossing the lines with absolutely the patient's got a right to complain, and they're often upset, and we'll talk about that in the next section, for a lot of reasons. They're in pain, they're frustrated, they're confused, under the influence. There's lots of reasons people get very upset, and some people are just that way by nature. But our staff and the organisation has a right to provide a safe workplace. So there's a zero tolerance for violence and abuse in the organisation. So we've got strategies where we would actually ask the patient, the person complaining, to lower their voice, not get so agitated, and we're quite happy to engage with them, but if they continue being abusive, we have a zero tolerance for that sort of behaviour. So the conversation would end until they're prepared to engage calmly. If that wasn't, we try and address that then and there in the moment. And yes, wherever you are in the situation, we would need to have a place we could take them aside so they're not disrupting other people, or so they've got the privacy to vent. But that staff member also needs to be safe and have someone with them and not be in a vulnerable position. So that person could ask for assistance, ask for someone else to come with them, and someone more senior step in, because there's always someone else around that can come in. So yeah, it's a balance between hearing the person but maintaining that zero tolerance for aggression, abuse. Yeah, for sure. Does that answer that? Yeah. Very good.
Yep, thank you.
No, thank you. So I'll send you guys an email, and it has a document that's our legislative standard on complaints management, and there's just 2 simple questions to answer on that, which I'll direct you to where they are. It's not going to be onerous at all, and that's your external individual assessment. So and we'll do a few more questions in the next session, which will complete the joint team activity. Okay. So thank you, everybody, and I'm not quite sure when we'll get together. I'll send you the next invite for session 2. Thank you.